All right, thanks, Bob. On the Health Watch this morning, what you see on the outside can tell you a lot about what is happening on the inside. And joining us this morning to talk more about that, our good friend, Dr. Matthew Knight with Knight Dermatology in downtown Orlando. Great to see you.
Great to see you. Thanks
Happy almost weekend to you.
Almost weekend. Well deserved.
So this is fascinating. So you're talking about all the different things that are happening on the outside. And, you know, we see this. We can see somebody who are like, oh, I can tell that they've been in the sun too much, or I can tell that they might be a smoker, or, right? We see people and we kind of see things about them that tell us things.
That's exactly right.
Okay, so let's talk about the first one, which is how would you detect that someone might be having a thyroid issue?
Well, you speak to the nature of dermatology. It's not about skin cancer and cosmetic surgery like 200 years ago when everything got started. We used the skin to look at different things that could be clues to the inside of your body. This is well before we had blood tests and MRIs and CT scans and things like that. So doctors would look at your skin and say, well, you have brittle hair and you have dry skin and maybe you're intolerant to the cold and you could have a thyroid problem. And lo and behold, that was the truth. And that continues to this day. So in the old days, it was about old-timey stuff like leprosy. But in today's world, things like Lyme disease or lupus or other conditions can be diagnosed first by looking at your skin problems.
So you mentioned the brittle hair. Why would brittle hair be a sign that there's something going on?
So our skin is an amazing organ because its primary role is to keep things out. But it's also an incredible immune organ. So it has all these different immune things that it does, and your hair is part of your skin. And so dryness of the skin, dryness of the hair, dryness of the mouth and the mucous membranes can all say, hey, there could be other metabolic things at play, like your thyroid or other organs that could be driving this whole process.
Wow, okay.
So they're all interrelated to each other.
It is fascinating, isn't it, how it all comes together? Okay, what about acne or even too much hair? Like, and when we say too much hair, are we talking about the face or where?
How many women in their 20s and 30s have acne they just can't seem to get rid of? Despite all the topicals and antibiotics that they're on, it just never seems to get better. There's a connection in some women between the ovaries and the skin, where these hormones produced by the ovaries drive the acne follicles to where it just never gets better. In the worst case examples, people can have hair in places they didn't have it before, or even deepening of the voice. That's called polycystic ovarian syndrome. And it's a chance where if you make the right diagnosis, send the patient to their gynecologist for a little bit of estrogen, like a low-dose birth control pill, that it miraculously gets better.
Wow.
So if you can pick up on the symptoms of somebody's acne that's just not getting better, you can make a big change and prevent long-term scarring.
With something simple like birth control.
Right, very
That's
simple.
Amazing.
Low-dose estrogen can cure it in some cases.
Okay, fascinating. Okay, what about red rashes on the face, or if all of a sudden you just say, my hair seems to be falling out?
So this speaks to an old-timey diagnosis called lupus. The word lupus means wolf, and old skin doctors thought that red rash on the face that people with lupus got looked like a wolf, and that's how it got its name. But somebody that's got that red rash on their face, along with hair loss or sores in their mouth or other places, may be suffering from lupus, which is a very serious autoimmune condition that can affect all kinds of organs in your body, from the heart to the lungs to the liver. And if you diagnose it early, it could be a chance to intervene and potentially save a life.
Wow, fascinating. Okay, and then this is interesting. Swelling of the skin, especially in the lower extremities. Like, is this what we talk about, like when women are pregnant, all of a sudden we get fat ankles, or no?
Great. And that leads me to a point I wanted to make as well.
Like, oh, you're pregnant. You have fat, no.
Right, to not get over paranoid about these things. Because you could look at your skin and say, I've got this rash, and I need to see Dr. Knight because I think I'm dying. You're not. You're fine. But swelling of the lower extremities in some cases can be linked to heart failure, like congestive heart failure, or liver problems. These are things where you need to see your doctor to help you make these sorts of diagnoses, but it speaks to all the different things. There are thousands of these little clues in our skin. Our eyes are the same way, where doctors can pick up on these ideas and say, you know what, I think you may have a more severe health problem going on. We need to take the right steps to intervene in an early phase.
Wow, it's fascinating.
It really is. It speaks to why dermatology is such a cool field.
You are so lucky.
I know, I love it.
Dr. Knight, tell viewers how they can find you, please.
Right downtown, Knight Dermatology, or J. Matthew Knight, MD on Facebook, and have a great weekend.
Oh, you're the best. Thank you.
Thank you so much.
Great to see you, Doc. All right.